We're going to talk about periodontal disease. Do you know what that is, or have you ever heard of it?
Kinda. It hurts, makes your gums bleed. That's all I know.
Yeah, that's all true. So periodontal disease is a bacterial infection, and this causes an inflammatory response in the tissues of the mouth. And I have a handy little picture right here if you want to look at how it progresses. As you can see, it can get worse and worse and eventually cause bone loss. So, some signs of periodontal disease is like bleeding of the gums when you're brushing. Have you noticed any of that? That's good. Bleeding at night when you're drooling, or just random bleeding all the time. Also, like hot or cold sensitivity could be a sign. Tenderness, bad breath, a bad taste in the mouth, or you're feeling that your teeth are loose. So yeah, your gums would be red, there could be swelling, and they would like look spongy. Some clinical signs that we look for in clinic are like bone loss, which we look at through the x-rays, tooth mobility, which is when your teeth move, furcation involvement, which here's a picture right here. You can see like when the roots are like showing and there's a little hole. When we take probing depths, if they're anything over 3, that could be a sign of bone loss, which could be periodontal disease. And then while we're probing, we also check for bleeding, which could be a sign. So there are a lot of risk factors associated with periodontal disease. Some changeable ones could be like diabetes. If you have diabetes, this could lead to periodontal disease. Stress, medications, your nutrition, and your diet. If you consume alcohol, your socioeconomic status, and your self-care, or like brushing at home. Some unchangeable risk factors would be like genetics, how your body responds to infection, and then any systemic conditions. Dental factors would be like tooth surface irregularities, like weirdly shaped teeth, irregular positioning of the teeth, and then like braces or retainers and stuff could also cause it or be a risk factor for it. Some gingival factors are like recession, the size and shape of the gingiva, and if you do breathe through your mouth a lot. So, periodontal disease can affect systemic functioning. There's not a direct cause, but there has been shown to be an association between the two. So some systemic diseases associated with periodontal disease include respiratory disease, obesity, osteoporosis, diabetes, and cardiovascular disease. Do you have any questions? So there are lots of ways you can prevent periodontal disease. The most common way is just like home care, brushing twice a day, flossing twice a day, using a mouth rinse, keeping your mouth really clean. You want to use like fluoridated toothpaste or drink fluoridated water. You want to go to the dentist regularly so they can check and help reverse it if there is signs of periodontal disease. And then you also want to eliminate any of those risk factors that we talked about if you can. So yeah, do you have any questions?
I don't think so.
Okay.